Hi everybody, my name is Austin Dreamer. I'm the newest chiropractor here at Natural Health, and today I wanted to talk about the benefits of scraping. Scraping and chiropractic are two things I'm very passionate about, and I wanted to bring a little bit more attention to. So let's get into it. Have you ever had muscle tightness that won't go away? If you're a patient here at the clinic, you've probably tried chiropractic, and you might have even tried massage. If the answer to that question is still yes, I think scraping would be a good thing for you to try. Scraping, today we're going to cover what scraping is, how it works, who it can benefit, and how we use it here in our practice. What is scraping therapy? Scraping is a soft tissue technique that uses a tool to glide over the skin. Scraping therapy has a few commonly used names, such as instrument-assisted soft tissue mobilization, gua sha, and Graston. All of these things are aiming to do the same thing, which is break up fascial restrictions, scar tissue, and adhesions through the use of a tool. The technique involves using said tool to apply pressure or scrape along the skin. This stimulates healing by increasing blood flow and freeing restrictions. I just used a couple terms that you might be unfamiliar with, so I wanted to touch on those before we get too far into this. So what is a fascial restriction and what is an adhesion? Well, an adhesion is an area of connective tissue that has stuck together abnormally due to an injury, overuse, or inflammation. Adhesions form when the body begins laying down scar tissue over your muscle, fascia, tendons, and ligaments. This can cause altered movement, which then can result in pain. Fascial restrictions are similar, but specifically involve the fascia, which surrounds our muscles, nerves, and organs. When the fascia becomes dehydrated, inflamed, or tight, it loses its natural flexibility and ability to glide. This once again creates an altered movement pattern, which can result in stiffness, pain, tension, and poor posture. So how can I tell the difference between a fascial restriction and an adhesion? Well, adhesions have very unique feels to them. So when I'm gliding with my thumb or the tool over a part of your body, the skin can feel kind of gritty, and there's almost like a bubble wrap sensation when you go over it. So there can also be a physical difference. If you have any scar tissue on your body, that can look like a raised area, or it can be different in color. It has a certain feel, like it's a thicker area of your skin. Fascial restrictions are a little bit more complex in diagnosis. They appear more as a tight area rather than a localized grittiness. Fascia is a deeper layer than the skin, so it's not as easy to feel. Most of what I'm doing when I'm diagnosing a fascial restriction involves analyzing like a range of motion or your movement pattern. Common conditions treated here. We deal a lot with athletic injuries, chronic pain, postural issues. Things like shin splints, tennis elbow, plantar fasciitis, scar tissue from an old injury, or things like tech neck or low back tightness. So this is a picture of some of the tools I use. I have my briefcase here with me today that I'm going to pass along for you guys to look at. Okay. So as you can see, the tools vary in shape and size. Some are bigger and flatter to work on big muscles like in your legs or over your traps. Then we have smaller, more curved tools that can work smaller areas like into our hands. All of these tools are kind of tailored to the patient's needs, but as well as the doctor's needs. So some tools aren't as comfortable in my hands as they would be in your hands. So every tool has its purpose, whether it's for the patient or for the doctor. My approach is a chiropractor. So similar with chiropractic care, we do custom treatment plans kind of tailored to your needs. So a lot of what we do is often paired with an adjustment to completely increase mobility. Not only do we do this for athletes, but we do this for anyone. I think most people could use scraping just like most people could use massage. Frequency depends on the condition. Like I talked about with a custom treatment plan, it totally depends on what you have going on. If it's something that's more of an acute issue compared to a chronic issue, those are going to be two totally different plans. So we just spent a lot of time talking about things that I can help with. I really wanted to talk about things that we can't help with as much with scraping. Things like an open wound, an infection, or a fracture are things that are currently still healing and things that we would want to wait to kind of look into. Not saying that we can't scrape those eventually, but while things are still healing, it's just not a good idea. More serious things like blood clots, dealing with active cancer in an area, diabetes, these are things that scraping just isn't really in the realm of kind of your ability to fix. So that's something that we would probably try to avoid with scraping. I wanted to talk about a couple success stories as well. So initially I was gonna have my dad come with me to talk. He couldn't be here today. So I wanted to tell his story. He was my very first patient I got to scrape. I had just finished my seminar at school, and he came to see me on a weekend to hang out, and we got to talking about an injury he had almost 20 years ago. He was in a car accident, and he broke his neck and had a lump on the back of his neck that he was curious about if scraping was something I could look into or something I could fix with chiropractic. So I got the feeling, and it felt like an adhesion to me, and I'd seen his x-rays, and he did have an old healed fracture in the same area that his adhesion was. So after about 5 or 6 sessions of scraping over the course of a month or two, he completely regained his range of motion, which was incredibly limited. He's now able to completely look over both shoulders, where for the last 20 years he hasn't been able to do that. So that was something that was really exciting for him, but also for me as his son and his doctor, was I was able to help him get some of that motion back. He's also very active, so I still scrape him fairly regularly, working on random things. We kind of treat that more as a massage now. Another really exciting one was I got to take care of a local soccer team. I got to deal with a couple of boys with varying degrees of shin splints. One of the boys came in off of an MRI. So we made sure they didn't have anything too serious going on, but that was really rewarding and really exciting too, to keep those boys in for the whole season. All right, some takeaways before we close up here. Scraping has a lot of benefits. At our clinic, the most relief you're gonna get is through pain, improved mobility, and increased healing with faster recovery. This is a great tool when combined with chiropractic or massage care, and I think it fits really well into the scope of our clinic. Any questions? I'd be willing to answer. Thank you.